Today we are going to learn about the respiratory system. And there's not a ton of anatomy that goes with the respiratory system, as you see in this diagram, but the respiratory system specifically deals with our breathing. And as we talked about in the circulatory system, this can be combined also with the cardiovascular system, and they are very, very much linked together because they deal with the delivering of oxygen and the excretion of CO2. And it's the lungs specifically that are able to do that for us. And so today, what we're going to take a look at is the respiratory system, specific though to how we go about breathing. So when we look at the anatomy, we see that we have the right and left lung. Remember, this is anatomical position. And then the different divisions of the lungs are you have the bronchi, and that leads to the trachea. And remember, that's also known as the windpipe, but we want to know the official name. The larynx, and then we also have the pharynx, the oral cavity, and the nasal cavity. So all of those things impact the respiratory system. We'll get into the anatomy momentarily. What is the respiratory system? It is really just specifically looking at the exchanging of gases between the outside air and our body cells. Things like coughing, sneezing, laughing, crying, hiccuping, yawning, they are technically part of our respiratory system, but they're not necessarily dealing with the breathing part of it. So they deal with like a lack of oxygen, they deal with some emotional things, but not necessarily part of our actual breathing that is taking place. So the respiration that is involved, we kind of have it highlighted here in bracket with the blue. So it deals with breathing, so literally the moving in and out of air of the lungs, and then also the exchanging of oxygen and CO2 with the blood. Now, here's where we have this link where those two things are together. So the circulatory system, by definition, is going to do the actual transporting of things and then also doing that within the body. But remember, you really can't talk about one without talking about the other, and that's why specifically we kind of combine these sometimes, and we talk about the cardiovascular system. Cardio, heart, vascular, breathing, or the movement of air, they're combined together. And so now let's talk a little bit more about specifically the organs of just the respiratory system. So the lungs can be broken down into what we call lung lobes. So if you see these little curves that are going on in the lungs, they are that way because they're not just one tissue. They're made out of different lobes. As we talked about in previous video, our left lung is slightly smaller than our right because the apex of our heart kind of goes into that left lung. The bronchi can be broken down in what we call bronchioles, and then more microscopically on the lungs, we have what we call alveoli that are actually doing the gas exchange. Then you have the trachea that's coming up, so we're kind of going from bottom to top here. And then you have the larynx and pharynx, which helps us with like our voice. It also is going to help us with like breathing. The nose or the nasal cavity, and then the mouth. We know that we can breathe both through our nose and through our mouth. But a safer way of breathing is actually through our nose because it goes through the nose hair, and we're filtrating some of that air as it's going through. So let's talk a little bit about our nose. And so obviously it's the only real visible part of the respiratory system. Obviously, again, we can breathe through our mouth, but we can see that. Remember that we have a nose that can be divided into the left nostril and right nostril by what's called a septum, just like our heart is divided by a septum, the left side and the right side. And as we talked about, it really is our first line of defense with breathing against those things that cause us to get sick. And so what it's doing is, as it's entering, air is entering through our nose, we are filtering it out through our nose hair. There's also some other stuff in there to help us out. But then also, it's going to help warm it up for us. Sometimes, like if you've been outside ever and you've gone for like a run and you breathe in, and it's almost like your lungs are hurting. That's because you want air to actually be warm before it gets into our lungs. It's not good for our lungs to receive a bunch of cold air. It's also good for us when we breathe for it to be slightly moist. So if you've ever heard of a humidifier, or if you've taken like if you've been sick and you've had a humidifier in your room, or if you've had like oil diffuser, if you have one of those, those are helpful because they help get that into our just better air um, into our body. And so let's talk a little bit more about the what we call the upper respiratory tract. So notice how, especially up here, the nose isn't just like one big open thing. It's kind of got these different tissues that are involved to help us with that moistening, to help us with that filtering. We also know that sometimes we get food down the wrong tube and we choke. So what is supposed to happen is this little thing called a epiglottis is supposed to cover up uh, our trachea when we eat. And so food is supposed to go down our esophagus, and then air is supposed to go into our trachea. But as we know, sometimes that doesn't work, and so we have things like choking. The little hangy ball thing that you sometimes see in the back of your throat is called this uvula. And really, that doesn't really serve too much of a purpose. It's just kind of the separator between like our mouth or our oral cavity and then the esophagus area as well. And so it doesn't really have too much of a purpose. And then we can just kind of see how the larynx and the pharynx, the voice box, help us. So what we're doing with that is we are sending air through our voice box and we're changing the tone. And so if you're a male, sometimes you have a lower voice, and that's because we have a larger voice box. And if you're female, you just don't have as large, so not the sound isn't vibrating as much, and so you have a higher pitched voice. There's no real advantage for either of us to have anything, but that's just kind of how it works, male versus female. And so those are the parts of the upper respiratory tract. Again, you're not gonna have to know all this anatomy. I just basically want you to know nasal cavity, oral cavity, pharynx, and larynx. That's about it. But the nasal cavity is important because it also deals with our sense of smell, and it's also lined with mucus and cilia that help us with just making sure that we trap some of that foreign material that might be coming into our body. All right. So the pharynx is found in our throats, and there's three different regions of it. Again, I just want you to know the pharynx part of it. And so it's basically upwards in our nose, but then also kind of in that area where we might choke. And then the kind of the lower part is where we start to get some of the sound that's involved. So the larynx specifically is the voice box, and so that routes air and food in the proper channel, but also plays a role in speech, as we well know. And then there's cartilage that's involved. So if you have an Adam's apple, those can range in size, of course. Um, but that's just basically there to help with sound and resonating some of the sound waves that are coming through. And so here's kind of a little bit of a cross section of what that all looks like, just to kind of give you a little context of what we're dealing with. Then let's talk specifically about the trachea, also known as the slang for it as the windpipe. And basically that's a cartilaginous tube. And we have talked about this before, but if you just take your finger and you kind of rub your throat, you can feel those different ridges of the cartilage. And it's somewhat ridged because it helps collect like some of the mucus and some of the things that might be going into our lungs. And as we talked about, when you breathe in, if you get that cold air, you can feel that because it's a pretty direct path. You know, you can get stuff into your lungs. People that work around sawdust, you can get those little sawdust particulates right into your lungs. There's also a reason why lung cancer is a prevalent cancer. If you don't wear a mask or if you don't wear something when you're around areas that's bad to breathe in, you can get some of those particulates in your lungs, and that can lead to some cancers. Even very, very healthy people can get lung cancer. People that smoke are at a higher risk of lung cancer because, well, you're having nicotine and you're having that tar go directly into your lungs, and that can be a bad deal. All right. And so just understand that it's basically an open tube with some other stuff, some mucus that goes around it. There's some cilia. So if you've ever hawked a loogie before, you're having those cilia go in a direction, but we also are protected by that mucus. Here's kind of a microscopy picture of it, of what it looks like up close. And this next picture, now let's actually talk about the lungs. So now we're through the trachea. Let's talk about the lungs. So there's some language here that I do want you to know. So the trachea, definitely know that. The bronchi are these larger tubes. Bronchus and bronchi is just the same word in the plural and singular form. And then these smaller branches, so if we equate this to a tree, think of the trachea as the trunk. That works out pretty good. Think of the bronchi as the larger branches that are happening. And then you get into what are called the bronchioles. and those are the smaller branches. And then if we went one step further and we magnified like where the twigs of the bronchioles stop, then we get into the alveoli, and that's where the gas exchange is actually going to be taking place. So that's just a little bit of the anatomy of the lungs. Now let's talk about the actual gas exchange. So a key word here is alveoli, very, very important. And alveoli are these tiny little air sacs where gas exchange is actually going to take place. They have a ton of surface area because, well, you have a ton of blood that needs oxygen and needs to get rid of CO2. And so if we look at this in pictures, here's the illustration of this. So these alveoli are these tiny little circles, and there's some fibers in there. And now we see that there's all these capillaries, so we're very, very localized here, that are actually going to take little molecules of oxygen, little molecules of CO2, and put them on or receive them from the blood. And so, again, here we're talking about the tiny little twig branches, and now we're talking about, the very, very smallest part of the respiratory system with the alveoli. So very, very important. Here is an actual microscopy of this, where you're seeing these are like the blood vessels, the capillaries, and then these air sacs, little diffusion concentration going on within those alveoli where the gas is actually exchanged. So here's another picture of it. I'm flooding you with pictures I know here, but just so you can actually see this. So the blood vessels literally are going to be right across from those alveoli. That's how we actually breathe. It's kind of crazy how that happens. Just like how we actually, we eat. It happens on a cellular level. So just if you want to pause this picture, you certainly can. Here's one more micrograph of this taking place. So there's little tiny pockets where the diffusion can actually take place through those. So kind of cool. All right. So let's talk just a little bit about breathing itself. So breathing, when we breathe in, our diaphragm actually goes down to expand our lungs. When we breathe out, our diaphragm goes up, making our lungs compress. And so we call that inspiration as well as expiration. So inspiration, inside, you're bringing air into your body. And so the diaphragm comes down, making your lungs larger, as you're seeing with the picture. And then expiration would be breathing out, diaphragm goes up, and it squeezes the lung. So basically, inspiration, you're going from left to right. Expiration, you're going from right to left. So that's what we're talking about with breathing and the capacity to do so. All right, so in closing, the last things I want to talk about is that we have to talk about the heart and how this works. The cardiovascular system, you have the actual gas exchange that's happening within the lungs, and then the blood is able to continue to flow thanks to the cardiovascular system. It is a very, very important system for us and works hand in hand with our circulatory, also known as cardiovascular system.